all for joining us this evening. Our webinar today is called How to Rebuild Your Practice Now and After COVID-19. Our speaker today is Stewart Gandolf, and he is with Healthcare Success. And my name is Cindy Pankella, and I am the Senior Director of Physician Services at the American Osteopathic Association. And now I will turn it over to Stuart.
Thank you, Cindy. I'm really pleased to be here, and I see people are still coming on board to our webinar together. So we're going to spend an hour together, and I want to introduce my background in just a moment, but again, I do appreciate you being here. I know this is an important topic for everybody attending and just about everybody in private practice. So I also know that we, by experience, have a really broad range of people that are probably attending. We have people from primary care, specialty care, osteopaths of all kinds. We have people that are working probably in a hospital environment, people that have their own practice. Some are working in large enterprise level practices. So I'll try to make my comments work for everybody. Also, before we begin, we are living through a historic pandemic. Things are changing incredibly fast. Cindy mentioned a minute ago, this was all update as the time of the recording. I added a bunch of new things in the last 48 hours to this presentation from some of the ones I've done in the past. So things were changing really quickly. Thank you to any of the caregivers in the audience that are on the front lines, and thank you to the rest of you who are doing your part to keep our country happy despite the pandemic. Make sure we all, whatever our role in this thing is, work hard to protect yourself and your loved ones. Remember also, it's not over. So continue to encourage social distancing among pretty much everybody you meet. How we act today will be remembered forever, and let's get the word out together and help some patients. So I'm Stewart Gandolf. I'm Chief Executive Officer of Healthcare Success. We are a marketing agency. What makes us very unique is that we've been working with in healthcare for 20 years, and I've personally helped over 1,000 clients and lots and lots and lots of DOs during that period, and along with MDs, of course, and other specialties for other professions. Our team of about 30 people, all they do is market healthcare practices and hospitals. So the stuff we talk about today will not just be theory. We're not just consultants. We work in this world every day, and certainly while I speak and write a lot and do things like this a lot, at the end of the day, this is real world advice we're providing to you. So as we get started here, the first thing I wanted to raise here is that the states are reopening, and my sort of joyous photo is meant for a lot of reasons. Hopefully you're relating to that as potentially the happy family in the picture. It also gives us a sense of some hope for the future, and or that might be your patients, back out, into the world. But at any rate, it is sort of a leap forward. And right now we're, despite a lot of uncertainty, need to think about our marketing moves to rebuild your practice. Now, if the word marketing scares you, don't worry. Marketing is a pretty broad concept, and I'll talk about that later. And I should mention as well that in my experience, an audience like this will have people that some are extremely marketing savvy. Some have worked with agencies like mine, have great big marketing budgets, and many locations, and it's more of a institutional. Others maybe it's a single practice, with a small practice with maybe an assistant. So I'm going to try to help everybody on that continuum, no matter how savvy you are or not on marketing, and we're going to do that over the next hour. So I mentioned a minute ago things are changing, and here's an updated map from where we are in terms of reopening. So as you can see, some are already partially reopened, others are reopening very soon, and some are shut down or restricted to this day. But even some of the holdouts like California, where I live, are beginning to talk about opening things up at least somewhat. So again, it's very, very divided across the country. A lot of times you hear blue states versus red states. It's that, but it's more. Certainly there's a lot of different opinions on this, and we'll talk about that in a minute. So as I mentioned a moment ago, we are at a time of change, a time that's very unsettling. And so some of the headlines I pulled together in the most of these are from the last couple of days. This first one was kind of when this all even became possible. Of course, we were all advised to hold off on elective surgeries, protect the PPE, protect patients, not overwhelm the system. And so right around April 17th, Becker's ASC News, for example, reported outpatient elective surgeries to restart under the first phase of Trump's plan. Similarly, a roadmap from the American Hospital Association came out saying that doctors and hospitals can begin to do elective surgeries as the curve flattens. Interestingly, just a couple days ago, how doctors are keeping patients safe as elective surgery resumes. U.S. hospitals promised new safety measures. So what's happening then is some positive news here, helping ease patient fears about the coronavirus. Trump says it's safe to reopen states as governors grapple with restrictions, which is obviously related. But the news isn't all encouraging, obviously. It's still not over. And so a headline from yesterday, millions of layoffs to push unemployment rate to the highest level since Great Depression. Other articles talk about the 30 million jobs that have been lost in several weeks. In terms of the reopening, not everybody's convinced this is a good idea. So U.S. officials warn of new virus surge as states reopen. Models project stark rise in deaths as states reopen. These are credible sources, Wall Street Journal, New York Times. So there's obviously every state is a little bit different. At the end of the day, the healthcare doctors like you are going to make decisions that make sense for your practice and your communities. And then, of course, we've talked about the opening. We've talked about some of the scary news. And then on the financial side, medical practice is real financially from COVID-19 losses. This was in Medical Economics a couple days ago. As visits plummet because of the coronavirus, small physician practices are struggling to survive, again with the New York Times. So it's a very, very unsettled time. And I want to start then talking about what does this mean to doctors? What's happening from the doctor and practice's point of view? Well, first of all, and you've talked about this in some other webinars from the AOA. Cindy's talked about this with me, and that's great because about half of doctors, depending on the source, I've seen a little bit over half. Merritt Hawkins is a respected source. They said about 48%, but about half of practices overall are using telemedicine. That includes specialists, generalists, osteopaths, MDs. But it's probably, from what I'm seeing, pretty representative of just about everybody. So a lot of practices are. Obviously, some limit was better telemedicine than others. Some it's kind of impossible for, but about half of practices using telemedicine. Interestingly, 38% of physicians are seeing COVID cases, and of those are feeling a lot of stress, apparently, 30% of them, but they say they'll continue to see patients. About 2/3 of the doctors who are not seeing COVID patients say they were willing to do so, which hopefully we won't have any more surges, but if we do, it sounds like there's doctors ready and able to assist. 14% of doctors say they plan on changing their setting, the way they're doing business, and sadly, 18% say they plan to retire, temporarily close, or just opt out of patient care. So again, just lots and lots of change going on. Some new stats here in terms of ambulatory care and ambulatory visits just overall. Now I recognize we have very different, we probably have orthopedic surgeons on the webcast, primary care, and kind of everything in between. But again, overall, about 60% decline in ambulatory visits in recent weeks. And what's interesting is nearly 30% of all visits at ambulatory practices are now provided by telemedicine. However, as the number of visits, telehealth is helping, but it's not enough to replace the volume. So it's partially offsetting the loss of physical patients, but it's just not enough. Again, talking about specialties, not surprisingly, it's hard to do ophthalmology without seeing the patient. It's hard to do that through telemedicine. A lot of that isn't urgent. So big drop-offs in things like ophthalmology, otolaryngology. There's been drops across the board, but obviously some specialties are hit harder than others. MGMA came out with a survey recently about the financial impact, and sadly, this was back on April 7th. It's probably much, much worse now. 97% of practices said they are experiencing a negative financial impact, directly or indirectly, related to COVID. 55% decrease in revenue, 60% decrease in patient volume. I wish I had a live audience. I could see you. I bet I'd see a lot of nodding heads right now. And projected layoffs, 36% and 60% furloughs. Really, really, really tough numbers today. And so my job today is to help you as much as I can with that. Finally, and I know this is depressing, but we have to talk about the truth here. 95% of practices in California, this is the California Medical Association, said they were worried about their financial health. Extremely worried, 46, basically half said they were extremely worried, and 76% were very or extremely worried. So that's really, really disturbing. And if you were to read through all these are just some sample comments that the doctors gave. Doomsday, it's very scary. So again, though, there are things we can do. We are not, and some things I will share with you today that can help. So I recently did another webinar where they had polling was a little easier. The numbers we saw were about 5% never really stopped. About 20% had resumed in the last, resumed back to full, they were doing procedures, but about 20% have resumed procedures in the last week or so. Another quarter expect to do it the next week or so. About 35% expect to open up only by June 30, and roughly 15% said they plan on opening after June 30. So I know from experience and working with doctors like we do, it's really a mixed bag. For your practice, I'm not a clinician, and obviously you know your practice a lot better than I do. So people ask me, what should I do? And it's like, well, obviously there's a lot of things to consider. There's available and applicable state orders and restrictions. You can look to the guidelines that are put out, by AOA and others. COVID infection rate locally is a big part of this, of course. How prepared are you? In fact, Cindy and I were talking offline about that, and how do you interpret the guidelines and how do you prepare? The economics related, because some practices are easier to open now than others. And the doctor's comfort level. Some may feel like, well, I'm able to open, but I still don't feel comfortable. I don't think it's good yet for the broad population. And then, of course, consumer demand, which is the great big question mark. So speaking of consumers, drinking some water here. We have the consumers obviously have a big role here. This is the best photo I could find for work at home. Some of you may be able to relate to this. Americans, as I mentioned earlier, are extremely divided. I mean, some of you may have seen the near riot in Michigan where the protesters with guns came, and they either A, feel like it's time to end social distancing, or B, just don't even believe in the coronavirus. And it seems to be coming into the media now. So some people feel like the situation is getting better, some think it's getting the same, some feel like it's getting worse, but it really is divided in many, many ways. So looking at some data, these again are very trusted sources. This happens to be from McKinsey, and these are as up to date as is possible. I spent, 2 days preparing for this webinar. So not knowing how long the situation will last, the economy, overall public health, and the health of myself and my family, all of these people, over half to 2/3, felt very concerned or extremely concerned. So that tells you that your patients are really, really not there yet in terms of feeling comfortable. In terms of the economic side of this, I've seen various stats from various sources. This one shows about half said that they are strongly agree with, I'm very careful how I'll spend my money. Usually I see between 60 to 70% say they will be cutting back significantly on major purchases. So these kinds of numbers are consistent from many different sources. Now, that'll have more impact and less impact based on the style of practice, right? So if you have a heavy surgery-based practice with a lot of people with high deductible insurance plans, they're going to pay more out of pocket. That will have an impact more than somebody who's just getting co-pays for family office visits. Likewise, interestingly, if Americans, when you ask them how long it will take to get back to a routine, 91% said 2 months or more, and 14% said over a year. Meanwhile, in terms of the economic impact being subsided, their personal impact, 72% said at least 2 months of disruption, 16% more than a year. So again, there's just some consumer hesitancy here. Now, another thing that's not surprising is that consumer behaviors are changing. So while 70% are delaying major purchases, there is some good news here. If you want to market, 95% of consumers say they're spending more time on in-home media consumption. 2/3 are watching more news, half are spending more time socializing with their family, half are watching more streaming shows like Netflix, about half are watching more broadcast TV, and 48% are watching more streaming TV. We'll talk about that later. Lots more time on social media. Again, what's interesting about this is just from talking to people we know, and both on the professional side and just this personal side, some families are really pulling together. I'm lucky. My kids and my family and I are using this time, and it's going well. Others are having a hard time adapting to this. So again, these are all just the behaviors we see. I thought this was an interesting slide. When you look at how these things are changing over time, what's going to be just we're suffering and we're going to put up with it, and what things are like, whoa, we should do this more often. Well, as it turns out, the one I highlighted here, telemedicine for physical, basically what you do, 180% user growth due to telemedicine, and of those, half intend to continue. That is a landmark change. Again, we're not going to redo the telemedicine seminars you may have seen, but it's just so true. And not just in terms of billing and coding and seeing patients as an alternative source of revenue. From a marketing standpoint, it allows new opportunities. It's a way to show that your practice is leading edge. It's a way to get patients that would not go to you if they did not have telemedicine. It's a way even to do offers where if you're doing elective procedures, you could do a consultation through telemedicine. It'll only get easier and better over time. So that's really important to know. That part has changed. And then finally, as we start to wrap up these stats, again, now patients, how long will it take them to return to care? Some said I'll go today, some said immediately after the pandemic ends, some say more than a month after that. But it is very interesting across the board, whether it's a hospital, urgent care, outpatient, or wherever, these numbers are similar. And my wife, for example, is getting a procedure next week because we feel like, okay, the epidemic here where we live is pretty much under control. We trust the facility we're going to take care of us, and she just wants to get it done. But it's across the board. Some good news. I know I've hit you with a lot of not as fun good news. This is some good news. So looking ahead, when respondents were asked, would you be willing to reschedule and come in earlier to appointments that you've postponed, the 57% said I would if the provider is available. And 38% said essentially they would as long as they feel like the site is safe and I'm less likely to get the disease there. And that's a big one right here. If you're taking notes, star this. 50% said that I would likely respond favorably if my doctor's office called me to reschedule. So that's a homework next step. If you get nothing out of this webinar, when you go back to patients who postponed or canceled, or it's time to come in for routine care, this would be the time to call them, email them, text them, and follow up, because about half say they're open to it. So here's some takeaways from all that consumer research. I'm referring here to a model by Everett Rogers. This is something that one of the reasons why I fell in love with marketing in undergrad was this concept right here. So the Diffusion of Innovations was created to look at the adoption of technology. So if you look at VHS tapes and VCRs, and if you look at DVDs and laser video, and now streaming, or mobile phones translating into smartphones, there's something bizarre about this, but these are predictable trends. So in fact, I would argue, based upon my experience working with thousands of doctors over the years, there's probably some that fit this curve as well in terms of adopting new procedures. So about 2.5% are just love being at the leading edge. They're just that way in their life. And then there's the early adopter phase. This is where I fit in my own world in terms of adopting technology. I feel like let somebody else get the arrows, but I'm still pretty early in the process. I like technology. I like them to sort out the bugs first, but I'm pretty leading edge. I'm not bleeding edge, but leading edge. And I have a lot of doctors I speak with feel the same way. Then there's the early majority. Enough people have tried it, they feel good. then there's the late majority, and then there's the laggards. And so this model is famous in the world of marketing. It's a really good way to look at, kind of where consumers are in readiness. And I would argue that even though this isn't technology, you're going to see this with consumers. There's going to be some people that first thing you like, let me in. It's like ready to go. So the innovators and early adopters will rush in. Then the early majority might wait a month or so. Late majority and laggards may take some time. It's just going to be a wide mix. So so some patients, again, will see you now. Others are just going to take more time. And we'll see. Hopefully, we won't get a big rebound from the opening states that opened aggressively and perhaps a little too soon. So we'll see. Some people are wanting to wait and see. Some people feel like I'm ready to go. So we're going to see this happen over time. Again, remember, patients are still worried about getting sick by being treated. Some patients are really concerned about spending money. But the final comment was, again, if you can actively, take an active effort to let them know you're there, they are likely to be open to seeing you. As we go forward, as we start to communicate, I'm going to tell you what to do here now. We're moving away from research and into what to do. So anything you do in terms of social media or advertising, whatever else, these are some of the things that we do for our clients that you can do for yourself on a smaller scale or perhaps on a grand scale. But generally, always acknowledge the current situation wherever possible. It just sounds out of touch to not. Be transparent. Look at, if you're doing any marketing, scenes of large crowds, handshakes, parties, just look out of touch. Be very careful of looking exploitative. It's possible to do that even if it's not your intention. Make sure you don't have any intended words like, we're dying to see you. Obviously, that's an extreme example, but you want to make sure that everything you do cannot be misinterpreted. Have empathy. People are grieving, right? So I'm guessing a fair number of the people in this audience today are grieving over the economic fortunes of their business. Some probably are doing really well. Some people are grieving over people who've died. It's a really big problem. Have empathy of other doctors when you speak to them. Have empathy. It's a common, it's important to know that we're all grieving here. It really is. So with all that said, and everything I went through in terms of where we are today, and again, there's some optimism here, right? We're all here, we're talking about this new topic. The question is, well, Stuart, should we hold off on our marketing until things, we're fully operational, things are back to normal, right? And I would argue, no. I would argue, do not stop marketing or refuse to start marketing. But depending on your situation, it may make sense to hold off on advertising, right? So marketing, yes. Advertising, maybe, depending on the situation. So as a reminder, because most people don't know this or don't think of it this way, traditional advertising is just one piece of the marketing mix. When we work with our clients, we create marketing plans for most of them. And we go through, what are your objectives? What is your competitive situation? What makes you unique? What's your strengths, weaknesses, and opportunities and threats? What's your target audience and budget? All those kinds of things. But then we break it down into these 6 categories. So another thing that's one of our favorite articles from our blog is just break down your marketing into these 6 categories forevermore. So internal marketing, which is a close cousin of patient experience. So those are all the things you can do with your patient base. Doctor referral building is for specialists, key. Primary care, if you're a specialist, getting doctor referrals from primary care, very, very important. Obviously, if you're a primary care, not so much. Digital marketing is the favorite level we use as an agency. Now, by the way, we consult on all this stuff. But digital marketing is where most of our clients invest most of their budgets because it's usually the best place to start. Traditional advertising makes sense for some businesses. Branding makes sense for everybody. Whether or not you have a brand, it's just a question of is it the one you want. And public relations includes things like getting free press, community events, being out there in the public, that kind of stuff. So even if you're currently closed, I want you to take this opportunity to invest in the long term. So this applies to everybody. So why should you do that? Well, first of all, a lot of your competitors and colleagues are frozen. They're doing nothing. So depending on your business, usually most of us want to survive and thrive into the future. And there's a lot of things you can do at very low cost if that's an issue for you. So I'd recommend that you take that. Also, your job is to at least plan for and prepare for the future. So what can you do now and invest in? What, if you're closed and plan to stay closed? Well, first of all, make sure, because I still see this, that you have an up-to-date COVID-19 notice on your site. I just went to one of our client sites and saw this notice we put together with them. Very specific, very clear, when they plan to reopen. This is great stuff. Having it on the website, having it on the homepage with links, pop-ups or whatever, but that's something you just have to do. If you're going to do marketing planning, this is a great time if you're less busy. If you've been meaning to get around to branding or creative work or a new website, great time for that. Long-term digital marketing projects I'll describe in a minute. For those of you that are more enterprise-level sites or practices with many locations or a hospital environment, then it becomes a much bigger issue to keep your employees and providers on the same page. If you're a small practice with one single doctor and a couple of assistants and maybe an extender, that's a little easier. It's easy. You don't need to send them an email and think about this. But in large organizations, keeping everybody on the same page is crucial. And then updating your social media and emailing patients. And I'll talk about that in a sec. So another thing you can do right now is to use organic social media to build your reputation and help save lives, even if you're closed. So in a speech I did a few weeks ago, I noted that the US Surgeon General, trying to get the word out about social distancing, trying to get the word out about staying at home, came out on CBS, one of the morning programs, and talked about getting Kylie Jenner, who has 4 million Instagram followers, to jump into the fray and tell her followers about the seriousness of social distancing. And guess what? A couple of hours later, she did. So when you think about the power of social media, where the Surgeon General is relying on a Kardashian relative to get the word out about social distancing, and then it works, it's pretty amazing. But I would argue, where's our doctors? Where's our hospitals? Where's our providers, right? So it's great that Kylie, helped out here, but all of us, anybody in healthcare, I would argue, has a responsibility to continue to get the word out about public safety, social distancing. Even if you're in a state where they're opening things up, nobody has said, run around and ignore social distancing. Nobody has said, with any credibility at least, ignore safety. So it's important now, as much as ever, to make sure people are aware that social distancing and safety still matter. You can take a leadership position to your patient base and others who see your Instagram and Facebook by letting them know what to do if they think they may have the virus. I just saw today, for the first time that I can remember, here in California, which is about as advanced as you can get in some regards for most things, finally saw a clear website where you can find local testing in Orange County where it was all in one place. It wasn't just a bunch of internet searching, but there is now something set up. So providing wellness tips or where people should go, assuring the public that you are taking the proper safety precautions, answer frequently asked questions. Now, blogs and patient emails are really, the three of them are sort of a triumvirate. You want to have good, strong content on your website on blogs, promote it to your patient base through emails, promote it to your patient base, and anybody else will see it through social media. By the way, this is just a series of free social media ads that we've created. If you're interested in those, email at the end of this thing, and I can send you a little packet of things that we have. They're on the creative side and fun side, but you're welcome to have those if you like. But again, organic social media, you can do that on your own. It doesn't cost anything. One limitation of organic social media, though, is it takes a lot of work to get 1,000 followers. And of those, maybe 20 or 40 or 50 might see any specific post. So you should do it, but it's not going to blow your doors down with lots of new patients. But still, it's something you can do that's positive. Interestingly, I was on a webinar yesterday on the hospital side. My friend Mike Schneider is head of Greystone Consulting. They do create do a lot of things, but Healthcare Internet Conference is something they do. So at the enterprise level, they interviewed hospitals, and sure enough, what were the hospitals finding were the most effective? Oh, exactly what Stuart just said works for practices. So social media, email marketing, blog posts, these are the things that are the most important things to do and most effective things to do during the pandemic. So let's switch gears a little. Let's talk about, let's say you're open now. What should you do then? Well, I'm going to go through with you a variety of different marketing strategies that you can do. Again, we're going from easy to more sophisticated in rough order. So the first thing you can do is, again, update your COVID notice, because you're no longer saying you're closed, you're saying you're coming in. So make sure that's the first thing to do, is update the notice on your website. Secondly, I would argue strongly that you should create a video, even if it feels amateurish to you, about your safety procedures. This happens to be from a hospital, but you can do this too. You can either simply, and most people are used to Zoom by now, you can do something really guerrilla by getting your staff and team on the same page, where each person talks about, you're the doctor, you're going to talk about what you're taking, your PA or your nurse practitioner talks about what he or she is doing, your receptionist or whomever taking turns talking about how you're going to keep people safe in the office. Obviously, if you're in an institutional business and you have a little bit more budget, you can get that professionally. You can do this with an iPhone. Don't let the technology slow you down. Patients, especially in a smaller practice, patients don't even expect you to be slick. And some of you, especially osteopaths, just sort of philosophically, are a bit more homey and friendly, natural sort of feeling. So those patients will love you for that. So make sure you do that. Call and text patients, as I mentioned earlier, who postponed your visits. You want to make sure that you do that to get them to reschedule. Email, again, is a super powerful tool to get the word out. One of the sad things about working with doctors for so long, email is not a new technology. The average practice I talk to does not have their emails organized with patients. If there's ever a time to do that, do that. It's not illegal, as long as you let them know that it's who it's coming from, it's clear that it's what the nature of it is, it's not misleading, and it has your address on it. There's some rules on this called can spam. Now you may decide that you want to ask them to opt out, but right now in the world of a pandemic, as long as you're doing this in a HIPAA way, I should say a HIPAA protected way, it's a good idea. Make sure you don't do anything to violate HIPAA. If you do email, I would say another thing that's key is to have a link to your safety page and on the video as well. Some businesses are really good at this. My wife goes to a functional medicine doctor. I'm not sure if she's a D or MD, but at least with sort of a functional integrative approach. And she's just great at this. My wife loves listening to her podcast. She does a simple little videos when she's at conferences. Right now, she's sending out updates. It's been very, very valuable to her. At the early stages of this, when they said, see your doctor, she emailed her patient base saying, no, that's not the right thing to do at this stage. We're not equipped for this. Here's what you should do instead. And instead of being intrusive, it built the relationship between my wife and the doctor. So I know you may not have done this, but I'm just telling you there's some opportunity here. And then, the old-fashioned asking patients for referrals. So as patients begin to come back, if it were me, I would say, hey, did you have a good visit today? Oh my gosh, it was wonderful. Feel safe here? Absolutely. And hey, if that's the case, and you have other friends that are afraid to see the doctor and they don't have any place to go, please send it, let them know, let us help them just like we just helped you. You'll be shocked. Your patients will be thrilled to help. So these are really basic things that you can do without spending a lot of money. And preparing for this, I'm giving you a bonus section here. This is something I spend we do seminars a few times a year. And again, we're an agency, not an educator, but we love educating. So I usually spend about a half an hour on this topic because it's so important, and 95% of practices are so bad. People will get hung up on, they're left on hold forever, they're treated rudely, sometimes they're told the doctor's not very good. It's so vital to your success, especially now. I'm going to give you some bonus content. So first of all, when you have your team beginning to answer the phone again, make sure that they assure the patients that COVID precautions are in place to ensure their safety. And as I mentioned, my wife and I are going to be going in for elective procedure next week. And I've already asked her, so what are the safety precautions? How do we prepare? Will they give us masks? Patients want to know that. Make sure your team is scripted. They have this down. They feel confident. It's really vital to your success. Set up your team to succeed now by educating them, and in the future, the one thing that most doctors' offices do is they hire the cheapest person, they give them 1,000 competing tasks, and then the phone call becomes just simply something to get done as quickly as possible. Instead, train them, hire right, pay right, and then track the inquiries, how well they do at getting patients to come in. Keep note that new patient inquiries are typically the highest priority. Today, every patient inquiry is a priority. But know that new patient inquiries are especially difficult. Why? It's not because you're a bad doctor, because you had to advertise or they found you on the internet. It's just they have no relationship with you. So you want to make sure your team is ready to go, especially with those new patient inquiries. In busy offices for new patients, I recommend getting a call off the front desk, especially on something more complicated. If they have a lot of questions. You know what? I tell you what, Cindy is our patient ambassador, new patient ambassador. She's terrific at answering these kinds of detailed questions. She's in a quiet office. Let me put you in touch with her. That's fantastic. That she has the time to meet with the patient. Really important. If your office sounds and feels harried, your patient is assuming that your office is really harried. Tell your team and teach your team for new patient calls, at least the objective is the first visit. Nominate your best people to be on the phone for new patient inquiries, and be sure to get them in quickly. So this is always important, but today with COVID, I just thought I would spend just an extra moment or two. This sounds so basic. Just think about this. If you spend, let's say, $10,000 for a marketing program, and it brought in 100 calls, and you converted half, you could argue you wasted $5,000. But I would argue those 50 that you wasted times the amount of dollars they brought in could have been hundreds of thousands of dollars of wasted revenue and opportunity cost. So just having done this for many years and mystery shopped many, many practices, it's boring, it's not exciting, but still it's an area worth looking at. If you're concerned about this area, something you can do easily is script to this effect. Good morning, Dr. Gandolf's office. This is Cindy. How may I help you? It's just a simple, strong, positive greeting. Always get them to discover the need. We talk about establishing value. Oh my gosh, Mrs. Jones, I'm so glad you called. And I certainly understand your concerns about COVID. But let me tell you what, we take the greatest precautions here. We make sure that nobody's allowed to enter the building if they have a fever. We do this, we do that. We provide masks to people when they come in. We have to sterilize the office frequently and whatever else. But the greatest thing of all is, you're going to love Dr. Jones. She's fantastic. She's the most caring person. She's my doctor too. You'll love her. So let me see, I have Monday morning or Tuesday afternoon available. What's better for you? So that you can tell has been scripted. That is something that works. What I just did there at the end was a dual alternative close. I answered the objections about COVID. I established value. So these are the kinds of things that make a huge difference in your bottom line, because it doesn't cost you anymore to do the phone right versus to do the phone wrong. Okay, so moving on. So those were internal things. If you're a specialist, again, about 40% of osteopaths are specialists. So if you're in that category, number one, first thing to do is review and prioritize your past referral sources. Hint, most specialists wildly overestimate how well they know who's referring to them. I see this all the time. What happened to Joe? He's my friend. I go golfing with him. And you go check the records, and he hasn't seen a case in 2 years. Well, it could be that Joe doesn't know that they're not referring. They've created a list, and the front desk doesn't like your office, and you're not getting anybody. So it's really important to audit, see who stopped referring, see if you can fix that. Redevelop your relationship. See who has potential. Maybe somebody's referring a ton to you, and you've never said boo to that. So this, again, people are slower. There's opportunity here. This is a great time to reestablish relationships. And I would say on these, as you reach out, and again, most doctors have more time these days, reach out to them by phone or text, email, whatever's appropriate. But remember, ask how they're doing, right? They're under stress just like you are. So it's a perfect excuse to rebuild your relationships. On the primary care side as well, there's no reason you can't reach out to your referring doctors. We're all in this together, especially in the healthcare community, right? So do it from that standpoint. It's not begging for referrals, it's keeping the relationships alive. A concept we've been talking about for years is physician liaisons. Now, in the old days, when I started doing this 20 years ago, I used to spend a lot of time trying to teach the doctor on how to go out and build relationships. And in a group of, say, 20 doctors, there's usually one that likes that and is good at it, but usually everybody else wants to throw things at me. Stuart, I became a doctor, so I don't have to do that stuff. So instead of doing that for most practices then, physician liaisons is a concept borrowed from hospitals. It's now being done routinely by big orthopedic groups, big cancer groups, even individual practices sometimes have physician liaisons. That's a whole topic in and of itself. If you're interested in this kind of stuff, you can email me and I can point you to some blog posts about how do you hire the right person, fire them, train them, recruit them, who's good, who's not. A little hint, a clinician who has sales skills is great. A clinician who doesn't have people skills is wrong. There's all kinds of mistakes in this category, but the right person can rock at a practice. Also, another thing that we're seeing, there's a big transition now towards people who just can't get in, right? So practices are getting bigger, more corporate, clearly. People have policies against, not just drug reps, but physician liaisons. So there are a lot of things you can do digitally to reach doctors on a one-by-one basis. And again, that's something that if you're interested in, just send me an email. I'll send you a link to a webinar I did like 2 weeks ago on that topic. It's a big topic. It's a long topic. I don't have time today. Again, this is all free stuff I can provide to you in the spirit of helping. But there are some digital things you can do to stay in touch at scale with referring doctors and to meet and build relationships with new doctors. So we've covered internal marketing. We covered doctor referrals. Let's talk about digital marketing, one of my very, very favorite areas to talk about. Today, by the way, we're not going to talk about branding or PR, but we are talking about digital marketing, advertising next. So with digital marketing, again, the world has come to the web. Most people, depending on the stat you see, up to 90% of people have looked, research doctors online, both websites and reviews. And today, I think the last stat I saw on this, about 70% of people will research a doctor online, even if they're being referred by their primary care doctor. So the website is the center. It's your front door now. Think about it as would you have a front door to your office and they walk into moldy, filthy, muddy carpet? Well, before they get to your front door, if your website's a mess, that's muddy, dirty, filthy carpet. So the website is the beginning of everything today. It's the epicenter of marketing. So either update your website or create a new one. Again, I know that cash may be tight, but you have the time and focus on this, and presuming that you're committed to staying in business and you're going to do this anyway, it's a great time to do this. There's low-cost solutions and high-cost solutions out there. There's templated versions. Some way, somehow, get the website updated. Search engine optimization, when I speak about this, search engine optimization is all about getting free traffic from Google and Bing and everybody else. And so SEO is a long-term, never-ending race. So if you looked, I looked up today medical marketing, and my SEO guy called me, at least here in California, but probably nationally, we're #1 for medical marketing. I have competing agencies call me, and they say, how did you do this? You're up, you're top of Google for hospital marketing, medical marketing, doctor marketing, physician marketing, urology marketing, all these kinds of terms. And the reason is because I've been doing this for 14 years and we know what we're doing. But that didn't happen the first day. But the great news is if you start building search engine optimization, you're committed to it. And now would be a great time to take money you were formerly spending on advertising and putting into SEO because it's long-term. So you may not see the benefit of it right away, but it's long-term, and you never, ever want to stop SEO. You want to create a system to improve your online reviews. There's multiple options out there. We use one that can help encourage the positive ones to review in an ethical way. But in any event, whichever system you use, you want to make sure you look at that. That's a huge area. Again, yet another topic for a webinar that I may do in the future. Organic social media posts I referred to earlier. This is stuff you can do right away. Just recognize it's mostly going to be your patient base who sees it. So those are all things you can do on your own. So hopefully those were helpful to you. I try to give you a lot of, even if you're on a tiny little budget, to give you a lot of things you can walk away from and make an impact and to your practice now, because that's really important. I know we have some small practices on the line. Those are all things you can do that are beneficial, and you can expand that idea. You can do, for example, you can start doing webinars and get your patients involved and talk about wellness, and post your webinars on YouTube, or do Facebook Live. So there's some clever ways you can start doing this as well. But I'm going to move on, because we don't just have small practices here. We have practices that are mid-size and larger, and or small that want to be larger. So I'm going to cover some of the stuff that we do every day. So does digital or traditional advertising make sense for you now? Well, we talked about this a little earlier. It could make sense for you if first of all, you're open and you want to attract patients now quickly, then absolutely, digital advertising in particular makes sense. Or let's say you're closed, or mostly closed, but you want to build market share while others are fleeing the market. We see this a lot right now. You want to position yourself as a community thought leader, and you really want to help educate the public. Again, we see this a lot right now with hospitals, but not just hospitals. Our hospital clients are doing this, addiction treatment centers are doing this, skilled nursing, practices, all of you can take an active role in helping the community get better. If you want to build your brand for the long term and capitalize on your competitors' absence from the marketplace, so those are all reasons why you would begin doing advertising. Again, we've made a switch here to advertising. Where did that go? And you enjoy a reasonable marketing budget. I don't know why it's doing that. Sorry. We're going to jump to the slide. So when would it not make sense? Well, probably not if you can only invest in direct response advertising, where every dollar has to return immediately trackable return on investment, or if you're struggling financially.
I'm sorry, Stuart, we can't, you lost the full screen.
Yeah, no, I had to back off because my screen was, it was bouncing for some reason. Let me see if it goes back to full screen now. Are we good? Cindy, can you see that?
Sorry, yes, much better, thank you.
Good, thank you. So now I recognize that some of you are very, very savvy at this stuff, but others are not. So I'm going to take just a 1-minute primer. So when we talk about advertising, I'm going to share with you the most impactful, especially if you're small to mid budget. But really, this is at the heart of a lot of what we do for clients. So the first thing is there are paid ads. These are called pay-per-click ads or paid search. These are the first ads that you see on top of Google. And sometimes I have doctors tell me, well, I never push those because I know they're ads and I just don't want to go to those. That's fine, but clearly billions of people do go to that, and that's 80% of the Google fortune is this right here. All that other stuff is great, but the real money Google makes is from all these people clicking the ads. Now, the way this works is ads are prioritized based upon not just budget, but how good the ads are, how well they're clicked, how relevant it is to the search, and how good the experience is on the other end once they click through. So you pay literally by click. So that means that you don't pay if they become a patient. You don't pay if they just see the ad. You pay only if they click. So that's a huge area. And what's great about pay-per-click is, well, there's a lot of things. But one of the things is you can get up on top of Google like immediately almost. So we have clients, we can get them up on Google at the top right away. Very, very powerful tool. Again, there's a lot here. This is something else we could spend an hour talking about, but pay-per-click has a lot of advantages. There's some disadvantages too, but it's a great place to start for a lot of practices. Second category on the search page, these in the industry we call these SERPs, S-E-R-P, engine results page. This is the local map pack, we call it in the trade. Usually there's 3 people here. This is a whole nother game. To be good at this is different than what I just showed you. These are 2 different strategies. This is technically organic, which means you're not giving Google money. And so you can either pay for clicks or you can pray for clicks. But there is a complete strategy to make this. And then the third category, we call these the natural results. These are underneath the map pack. So which of these 3 do you want to be in? Well, if I had a point tool, we would find out what you say, but I'll just go to this punchline. You want all 3. We're pigs. At least I'm a pig. I want all 3. When I'm working with my clients, I want to be all 3 places. I want to dominate. That's how you succeed in internet marketing. Another thing that was the desktop version. I just wanted to show you how important the ads are on mobile. Mobile, by the way, in our experience, the heavy duty stuff is about 50-50 desktop versus mobile. Like, cancer is well researched. It's more contemplative. The easier stuff like primary care, urgent care, vein removal, those kind of things are about 2/3 mobile today. So consumers are heavily using mobile. And what's interesting about it is, given the limited real estate, you can see how important those ads are, because you're dominating. These first few things are dominating. You have to really work to get down to those natural listings. This particular snapshot I have here is only one paid ad. A lot of times you'll see 2 or 3 paid ads taking up all the real estate. So if you're in this Google paid search game, first of all, it's usually the fastest and most cost-effective method to get patients. I'm not giving you a rule here. It varies. Every practice is different, every situation. I'm not giving you, just like I don't give legal or medical advice, I'm not giving you marketing advice because I don't know you. But generally speaking, it's often the first place we look. It's because it's what I tell clients is it's an annuity that works over and over again. So I'm going to share with you some of my secrets from our team working with probably 100 campaigns running right now. So what we were seeing, first of all, our digital team has noticed that a lot of elective-based inquiries are down. So clicks are up. People are still looking for medical services, but they may not be inquiring as much. So people are still interested. They just are a little hesitant to call. Now, you can help part of that by having a really good safety notice on your website. But my presumption is it's going to take a while before things return to normal there. Some specialties are actually seeing increased conversions, like urgent care, addiction, primary care, are actually doing better. As a whole, not everybody's individual results may vary. Some categories, like, we do a lot with oncology, those are holding strong. Orthopedic surgery, those kinds of things hold strong. Although we're just beginning to turn on orthopedic surgery mostly, because most of that was elective. The search phrases, we're seeing things like preventative care, immune system. We do predict a better buys on Google because the market has gotten so soft. Some recommendations, if you have something up and running, whether it's your marketing agency, most of you probably have that, hopefully. Make sure your keywords are focused on action-based specific items. So I don't want searches like, what is an osteopath right now? I want a search like doctor near me or DO near me. Terms that are very, very action-based. Don't waste money on what we call research terms. You want action-based terms. Make sure the ads read appropriately for the new reality. Closely monitor your campaigns and be prepared to pivot. Make sure your team makes adjustments to the landing pages and the campaigns as appropriate. Keep in mind that Google does not let you capitalize on COVID, which would be pretty quasi-ethical anyway. Telemedicine is big, so if you have telemedicine, it's something to think about. And if you're at the higher end of the scale and you're more experienced, we are having a success with some of the other things like programmatic display, native advertising, which means advertising as though it's sort of advertorial, YouTube. There's other places to go. Note, both Google and Facebook, if you've been advertising for a while, are talking about, though I haven't seen this happen, providing some credits to some advertisers. I mentioned my favorite things in the marketing world are, to start, that I can control, again, are digital usually. And digital, the first places within digital are paid search, like we just discussed, and then paid social, because you can reach, instead of reaching a few hundred people from your friends and followers on your social media page, you can meet tens of thousands or hundreds of thousands of people through paid ads. Extremely effective depending on this practice. It just depends. We, again, work with really every single specialty. I should have put up our page. Any specialty you could imagine we've worked with before, and often many, many times. So this can be a really good strategy because you're pushing the message out to people who are not necessarily looking for help, whereas search is all about people who are looking for help. If you're asking which social media platform, it's paid Facebook and Instagram. Those are the ones. Make sure the ads are relevant and appropriately emotional. Consider Facebook Live and other virtual events. Facebook is pushing Facebook Live, which is doing live recordings. Again, push telehealth. A new exciting opportunity is something called messenger ads, where it's sort of like a chat box. You can pre-program your paid ads and offer people who click a variety of different questions and then give them programmed responses, getting a ton of practical engagement from this tool and a lot of user social endorsement. So Cindy, I'm going to wrap in just a few minutes here because we're right about the hour, but I want to cover one more topic before we do. So we talked about digital. We talked about a lot of things. One last topic I want to talk about is more traditional advertising. So OTT, it means in connected TV, it really refers to advertising, for example, on Hulu. So it's kind of a part of traditional TV, but you can actually run these ads now through the same programmatic buying platform and run ads on just Hulu and other streaming services that allow ads. Likewise, usage of like iHeartRadio, Pandora, Spotify have skyrocketed because people are not driving as much. So digital radio is skyrocketing. And so usage of digital audio. So these are a little bit more sophisticated and they can be adjuncts to your advertising plan. And then finally, traditional advertising, if you're asking us what our thoughts are there, and this again is somebody who's has the right mindset, budget, and all that, but streaming radio and then traditional television are some of our favorite opportunities right now. Billboards and print, not so much. Viewership and ownership, as I said earlier, are way up, yet advertisers are fleeing the marketplace due to COVID. What does that mean when you have less advertisers and more inventory, right? Prices go down. So create ads that have positive messaging and are about to the community, relevant for the time we're in. If you have an agency media buyer that knows what they're doing, they can get some great deals for you. You know, a media agent is, you know, will buy more than pay for the commission on this. And our media buyer right now is asking all of our clients for, or all of our media outlets for more. And it helps when you have somebody who's been in the market and has relationships. This world of media buying is very much based on relationships. So if you have a media buyer, for example, our buyer in Chicago was able to negotiate 80 free community-oriented radio spots while adding in some inline streaming for audio. Likewise, in Texas, he was able to, one of our multi-location businesses, we wanted to move out of TV for this month, and the rep actually provided us 180 free spots for radio, just as a measure of long-term goodwill. Pretty amazing. So if you're doing advertising and you really want to have more of a market presence, there's some big opportunities here right now. So some final words, and I'm going to turn the ball back over to Cindy. We're going to have, before I do, I've got a couple things I want to cover, Cindy. Number one, there is pent-up demand. A lot of people have been out putting off getting care, but some of these personas will act sooner than later. Others, some will be able to jump right in. Others are going to be more cautious. It's just human nature. A lot of campaigns are getting interest, but conversion rates may be lagging behind historical norms. You want to monitor results continuously and stay prepared to pivot. The recovery will take time. Please try to be patient. So these are some really important thoughts. Also, things will likely never be the same again, but that yields new opportunities. You know, the greatest example of that would be telemedicine. That's such an obvious one. This is my contact info, and Cindy's going to share it again in a moment. I did mention a lot of different content that's available to you. So if you'd like to get more content, like I've been referring to, it's zero cost. Just email Kyle, K-Y-L-E, at healthcaresuccess.com, and we'll be taking some questions. So please make sure you start feeding the questions in, and Cindy will be asking those for me later.
And now we will go to questions. And I can't believe there is not one question in the Q&A box. I think you overwhelmed them with everything.
You know, it's really funny. I just had my last webinar. I did another one this morning, and I had a bunch of questions that I can refer to. If nobody asks any questions, I'll share some of the ones I had this morning.
Yeah, please do. And if anybody has any questions, please type them in now.
So again, we have lots of information, and I'll just talk about some of the things. So search engine optimization was a question that came up in the one I did earlier this morning. And they said, hey, Stuart, we're getting a lot of calls from people pitching search engine optimization. And my warning there was, the problem with SEO is it can be really fantastic, But the firms there, it just really varies. There's some really good ones, and there's a lot of sort of shysters. I don't know what it is. If somebody's offering you $700 a month or something, it's probably, they're not doing much. So real SEO requires content, and it requires ongoing effort and real strategy. So just the secrets to SEO require, number one, creating, again, just really good content. Keywords and simple stuff are really important, but the content's even more important. There's something called schema that we'll be talking about. Well, actually, if you're really interested in SEO, I have another white paper on enterprise level SEO that you can take a look at. But SEO, again, is really kind of all over the board. Another question we had this morning was, how do you create a marketing plan? And again, I've mentioned earlier, if you're serious about marketing the practice, you really want to get to think through, okay, what are our objectives, both qualitatively and quantitatively. Think through what are your target audience. What kind of patient are we looking for? Mentally, psychographically, income-wise, all those kinds of things. It's very different if you're going after a broad audience versus a very targeted audience. Think through your budget, think through your what makes you unique, create a positioning which answers why you. Those are the kinds of things that you want to do. And then again, just simply break it down into those 6 categories. Any questions yet, Cindy?
No.
All right, well, let's pause. I want to see, I'll think of another one while we're waiting for anybody else to throw in here. We still have a lot of participants left, so somebody must have some questions. You're all still here. Come on, you want the answer.
It's funny, when I managed a practice years ago, we had a new doc start, a new GI doc, and he was worried that there were too many GI docs in that hospital and that, he wasn't going to get any patients. And I told him, don't worry, I'll get you patients. And what I ended up doing is, and this tells you how long ago it was, maybe like 4 times a day, different, twice in the morning, twice in the afternoon, I would have him paged overhead in the hospital. Well,
I love that.
Other doctors all heard his name being mentioned, and, they're talking, trying to figure out, who is this guy? He's here all day long,
I love that. It's funny. I have a similar story. A friend of mine, one of our favorite clients, Dr. Fang, is an oncologist, and he was very active at his hospital. And he kept saying, but it was legitimate, calling Dr. Fang. He was like, who's Dr. Fang? And then the patient's like, you must be fantastic. So that's really funny.
That's it.
Another question that comes up a lot, Cindy, that, on that note, since you brought up, what's really great about marketing, we have a couple more ideas here for your audience while we're wrapping up. One is, what do we do to support new doctors? And or it could be support a new location. It could be to support a new technology. And I've seen this issue about marketing almost tear practices apart. I still remember going to a neurosurgery group in Arizona where they had, I think, 24 doctors, 12 neurosurgeons, and 12 neurologists. And, roughly 2 or 3 were highly pro, 2 or 3 were just dead set against, and everybody else was in the middle. But the ones that were older and dead set against, would say things like, well, just be, available, affable, and able. And the younger doctors are like, that was a different world. So I would urge you to recognize that if you have younger doctors and they're not getting the traction they want, it's not because they're lazy. It's just much, much harder. So another thing to think through is that, building relationships with their doctors takes active effort. It just is not the same thing. It's just, I hear this every day. So it's more than being able, affable, and available. That's why we oftentimes have the physician liaisons. That's why we often use the digital marketing. Another thing that did not come up yet is consumer direct. So the meaning that patients now are consumers. They're choosing their own doctors. Thank you very much. I mentioned earlier, even when somebody's being referred by their primary care doctor to a specialist, the overwhelming majority of patients check them out online and decide if they're going to do that. And amazingly, if they don't like the website, they may very well go to somebody else, or at least call somebody else. So those are some things to think about as well, that today healthcare is super consumer direct.
Yep, absolutely. And I think one of the other things that marketing, is that script, like you mentioned, with your front desk people. I mean, a front desk person is the first person, anybody from your, that representing your practice. And if you've got someone there that can't answer the question, or that, comes off a little too short or something with somebody, they'll keep shopping. They'll keep shopping,
Yeah, for sure.
and it could be just a simple thing. Instead of just saying, please hold, asking, can you hold, and waiting for them to answer.
Yep.
So all sorts of those type of things all play into putting a positive image out there on your practice.
Hey, we're getting our favorite, and people are warming up.
Yeah.
Got
So
some questions here.
how best to handle a negative online review?
Right. And then another one was, what's the best way to ask for a positive patient?
Positive review, right.
People are really interested in that. So let me do a little, most of our audience is still here. I'm proud of you guys. You all get A's. Let me give you some bonus material on reviews. So first of all, when it comes to your own practice name, you want to dominate the first page of Google. So clearly, when people Google the name of the practice or each individual doctor, you want to dominate the page to the extent that you can. So how do you do that? Well, first of all, when it comes to your practice name, you should have, this is an area where, we're not big on Pinterest, for example, for drawing in new patients, but having a well-stocked Pinterest account would be just another social media page. So that if you have a YouTube channel, a Pinterest page, a Facebook page, an Instagram page, Twitter, all these different things are just more media properties for your business. And so when you have those, then you're more likely to get to have that show up in addition to your practice website. And then as you start speaking and start being active, again, they're going to see many more instances of your business because you're dominating the page with lots of content. So the first step is to try to push everything else off your website or off the page. Right now, sadly, so many doctors, and I bet if I were to audit participants here, I would see that a lot of them, their own website's not even showing up, right? Health Grades is showing up. Yelp is showing up. I don't want that. It's really tragic. If you have other people showing up under your name, you have to fight to own that real estate, right? So the first step is to create properties, create content, and push that other stuff off. Then a review for your practice name, like, Mountainside, Family Practice or whatever. Once you own that, then you also want to start thinking about reviews for Mountainside. So that's a little harder because you are more likely to get rating sites, right? But the step one was try to push stuff off the page as much as you can with good content. Step two is, okay, how do I get positive reviews? So there's a number of ways to do this. I'm going to give you a precursor. Yelp hates you even asking for reviews. Yelp is completely against this. It's against their terms and policy. They're on the extreme. It's a religion to them. Yelp also happens to be the same company that somehow doctors tell me ignores all their positive reviews but puts up only negative reviews. So that's a rap they've had a long time. If you Google, I'm not saying they're doing this, but if you Google the words Yelp and extortion, you'll see lots of people are not happy with Yelp. So anyway, but Yelp does matter. Facebook, Google, those are the big ones. In medicine, there's lots of other ones. We actually use a couple different rating and referral services depending on the client. So I don't have an endorsement for you here because we use several. But whatever you can do, if you just think about this logically, one thing you can do is simply put a sticker in your window, saying, please rate us on whatever platform it is. Better than a slap in the face, but not super powerful. Another thing you can do is email all your patients and just say, hey, would you mind rating us? You can do that, but it's a little scary, right? Because you may not like what they say. So that's an option as well. Some services have a I was thinking about this just before this meeting. Those kiosks where people fill out the review while they're sitting in your office, there's all kinds of reasons before COVID to not use those. But now there's really, really a reason not to do that, right? You don't want to have I'm not going to touch a dirty iPad. So some services will allow you to text the patient while they're there or text them after they leave. Sometimes you can email patients. You can ask them to do it, but everybody has their phone. So the phone has a big advantage because it's theirs and they feel comfortable with it. On the hierarchy, email is sort of like a penny. Texting somebody is a quarter, and asking them directly, to, would you mind referring us, as $1, just because it's more committal, right? So that can all be done. The challenge with that is it requires someone on your staff to do something, and that's hard. So there are automated systems out there. Again, we use several, so I don't want to endorse one today because we use different ones for different purposes. But there are some out there that make this automated, where they can either email patients en masse or link with their medical records. One of the things that we do for some clients is there are systems out there that can do a survey of your patients, and then later on you can go back and ask the happier ones that you know are relatively happy to review you. So there's a lot of different iterations of that. The advantage of those kinds of programs, though, and by the way, that one is something that not all practices feel comfortable with, and certainly Yelp isn't excited about that. But there's a lot of different options out there, but hopefully that was helpful to you. But the key, though, is automating as much as you can, whether you're emailing them or texting them, asking your front desk person to remember. If she'll do it, fantastic. You know, if you ask everybody that comes through and text them a link afterwards, it's fantastic. Or using one of these automated platforms. So hopefully that was helpful to your audience there. So yeah, I covered both those questions right there. All right, next question was, what if the patient fears the pandemic and returning to the office because of COVID-19? Well, first of all, I really think that comes down to several things. I mentioned this kind of earlier. One is I would create a really good video and a page for your website. I think that's essential. And I would train your front desk. And you know, one thing you might be able to do is have the front desk talk to them. And then, you know, if they really, really are still fearful, what I might do after the end of that is email them a link to the video and the website and say, hey, I totally get it. You know, this just, you know, maybe too scary for you at this point. I don't blame you. You know, everybody has to make their own decisions here. We are ready here and ready for you when you're ready. So I wouldn't turn it into a big sales pitch because that would be off-putting. It's legitimate to have a fear, right? I think so. So if they're just not ready, they're just not ready. But another thing you can do is put follow-ups with them. Would it be okay if I follow up with you? Yeah, that's fine. Well, give me a sense, when do you think you might be more comfortable? Because if they commit to letting you follow up, that gives you another option in. So that's what I would do. A couple other things I want to cover before we wrap up here, Cindy. Some other questions have inspired, just occurred to me from my previous webinar that I think were both relevant. One practice said, you know, I want to start doing elective care. And how do I do that? And in this particular case, because it was for a vein webinar, he was a family practitioner and he wanted to do veins, right? Varicose vein removal through one of the different ablation techniques out there. And so I told him, you know, that's, first of all, we wrote a book on this about cash pay healthcare. So that's a big decision. So, you know, there's our book and there's other stuff out there that you could reference. But the short answer is I'm a conservative guy and I sure wouldn't just, you know, close my family practice and start doing veins. If you want to be successful in some of these markets, usually it does take a pretty big commitment. And that particular shit, by the way, veins is much harder now. The easy days are over. It's highly competitive and much more sophisticated. But what I recommended there was to create either a special microsite or a landing page that's all about veins. And then because that's a different business. So when you start getting into that kind of stuff, you really have to recognize that you're in a new business. Patients that are looking for vein removal don't want to know that they're going to be in the lobby with colds and sniffles or COVID or whatever. So it really becomes another business. So not to be misleading, but when you start getting into these things that are consumer direct, first of all, you have to have some place to send them, whether it's a really good page on your website, not the homepage, or a landing page, a separate one-page, sales page essentially, or a microsite. You need some place to send them. You need marketing to grow it, both, the stuff that we talked about, Facebook, Google. You can do communications to your internal team or your internal patients with your email or as people come in. You can do signage. And then the thing is, though, you have to recognize as you get into these kinds of things, it's a new business. It's a retail business. So, another great example of this, I remember once when I was first doing this years and years ago, a derm told me, he's like, Stuart, in our group, you either like aesthetics or you don't. Like my colleagues over there say, what the heck's wrong with you? Your skin's healthy. You should be happy. Shut up. Go home. Whereas this doctor really liked aesthetics, right? His philosophy was completely different. So it's important that the doctors understand that you're creating a new business, and it's important that you embrace this as a new business. And that means how you answer the phone for those patients. They're going to be much more likely to shop. They're going to be much more likely to ask about pricing. If it's aesthetic or if it's anti-aging and things like that. I co-wrote my book with Dr. Mark Tager, who's big in the anti-aging arena. Some of your doctors probably know him. I've spoken with Mark a bunch of times. We just wrote our book together. But, this idea of getting into cash pay is a big decision. But the things I can tell you is, A, be ready to promote it. B, you're in a new business. You need to understand a retail mindset. It's very, very different. You know who fails? And hopefully none of the people left on our webinar today are in this category. But the people that fail are the ones that listen to the device manufacturer and buy a $60,000 or $100,000 box that does, laser this or weight loss that or whatever. And they believe they're going to get everything they need from a website, and then they do nothing to market their practice, and they treat everybody like a new family practice. Those are just not likely to be very successful.
Yes.
It's a completely different mindset. And the fact that we have a DO audience, I think a lot of the opportunities you have, I feel like healthcare is moving toward osteopathy, right? Because, my wife, for example, when I first met her, she had an osteopath and she didn't know what it was. I had to tell her. But, she's much more interested in, sort of an integrative medicine approach or more holistic approach, and sort of the philosophy and treatment methods of osteopathy are really, well suited for that. So those are some things you can think about. Another thing that came up today, and this is just something to keep in mind, for the larger businesses that are on the line, we have sort of a sub area of expertise of working with multi-location practices. Not just, so we would certainly work, we have products for the little guys, like sort of turnkey websites and, easy marketing programs. So we have that. We call that Patient Fetch. But for the enterprise level, if any of your, anybody in the audience has an enterprise level business, just keep in mind, I'll share with you some things there. Number one, it's all about scale. So when it comes to marketing, you have to come up with a way to recognize that if you have 50 locations, you're not marketing one business, you're marketing 50 businesses, each with a different location. So as you start building marketing programs for a business like that, you just have to recognize that, the personnel are different. Some practices will need more help than others. The capabilities, I've worked with a number of multi-location derm practices, for example. Some offer aesthetics, some don't. Some have, extenders, some don't. Some have doctors who are sold out for months, others don't. So you really have to take each location as its own business and create essentially a marketing plan that works for, really any of those different aspects.
Well, Stuart, you gave us a wealth of information, great information. If anybody has questions after the fact that they think of, don't hesitate to reach out to either Stuart or myself, and I'll make sure to get you an answer from Stuart. And I thank you all for joining us this evening, and this concludes our webinar.